Today, we're going to talk about preventative medicine and functional medicine, how they both go together to really be proactive in creating optimal health. So, what's really important to know is that you can practice prevention. The best health insurance is to practice prevention, it's not to get sick. So, how can we do that? These chronic diseases, where we have root causes, underlying causes that are common throughout all of these chronic diseases. So we're going to go through today how in functional medicine we can be proactive and preventative and actually then be way ahead of this disease focused conventional medical system that is looking at the ranges on the labs, which is waiting too long to be proactive in many of these chronic conditions, such as diabetes and heart disease and Alzheimer's. We really want to look at optimal numbers on the labs. And that's why it is so important to not only get in depth labs that look at these processes in the body that tell us a lot about healthy biological aging. We know many of these underlying causes are contributing to it. So we look for on these more advanced and specialized blood tests that are there not optimized vitamins, minerals, amino acids? Do we need to really make sure that the nutrient needs based on the enzymes that we're looking into and studying and testing on these blood tests, do they require more of the inputs, the vitamins, the minerals, the cofactors in these enzymatic processes? And then we can optimize them. And that is key. That is key for aging well. We really want to look closely at metabolic function, blood sugar, insulin, and cortisol at certain times of the day, because that tells you a lot about the functioning of how a person is handling their carbohydrates, proteins, and fats. Their foods can drive not only blood sugar, but insulin, and cortisol is a big factor in the dynamic of insulin and blood sugar. So that all needs to be checked at certain times, all at the same time. And then we're looking at endothelial dysfunction. That is when the artery linings are inflamed and irritated, and it begins the process of arteriosclerosis, or the hardening of the arteries. That process is an inflammatory process, at times started as an immune response leading to inflammation. And then there's a buildup of plaque, and that plaque can lead to strokes and heart attacks. And this is what we are preventing against. Again, it's preventative medicine. So, preventative medicine then will look not only at cholesterol, triglycerides, HDL, and LDL, but we're going to be looking at the particle size, and is the particle size getting smaller? Because those are the more harmful types of lipoproteins or types of fats in the blood. And we want to look at is if there is oxidation, oxidative stress, which can contribute to this endothelial irritation or dysfunction. So, what's so important to know is that heart disease is not only just about cholesterol, it's about inflammation, oxidative stress, and about nutrient sufficiencies. And this is what is so important, because we see at times when homocysteine levels go up, which is homocysteine is a marker of endothelial dysfunction. We know that certain vitamins and minerals can really help to improve that process that homocysteine is involved in. So we see that we can directly make a difference with just vitamins and minerals and improving a marker of endothelial dysfunction, of a major marker, homocysteine, that has been implicated or associated with arteriosclerosis and Alzheimer's as well. So we want to improve these markers of uric acid. Elevated ferritin is a sign of inflammation. Homocysteine, again, endothelial dysfunction. Again, the dynamics of blood sugar, insulin, and cortisol together. We also want to make sure that the hormones are communicating. Thyroid is not just checking how the pituitary will. In other words, we need to be more advanced in our thinking about the thyroid. It could be a conversion issue where the thyroid is not at its optimal level because the active hormones aren't getting their required nutrients. Again, it comes down to being preventative. And if we can give the body what it needs, it can typically optimize that kind of communication, especially when it comes to our hormones and our thyroid. We want to improve adrenal health. That's why we're checking cortisol levels throughout the day and giving nutrients that support that process, the adrenal, stress, cortisol, epinephrine process. We want to look at the gut microbiome because an overgrowth of bacteria can be inflammatory and can cause the immune not to recognize itself. The immune system doesn't recognize itself and it starts attacking itself because the gut is inflamed and it has an overgrowth of bacteria, and the gut lining is less selective, more permeable. And this is something so important to get right and to be preventative. Quite often, if we can help fix the gut, we lower the bacterial overgrowth, whether it's candida or parasites, or whether it's commensurate or opportunistic bacteria and insufficient of the keystone species. We really need to have keystone species there. Those are the beneficial bacteria that produce metabolites. They help produce chemical messengers, metabolites in the body that help to heal the body, help to grow synapses. That's called brain neurotrophic factor. Brain derived neurotrophic factor is made in the gut based on bacterial fermentation. So you see, there's a process that we can optimize that can really be preventable for the diseases down the road. We really want to work on the mitochondria. That is a source of energy. And because the mitochondria uses oxygen when it takes in our the sources of energy, which are from our food, fats, proteins, carbohydrates, and converts it to energy, it requires these activated vitamins and nutrients, minerals. And it also a byproduct of that respiration, of that mitochondria action to produce energy, at times can be pro-oxidant, can be have free radicals, can come off this process because oxygen's involved. So we want to make sure the mitochondria has a sufficient amount of antioxidants, these plant polyphenols that are extremely beneficial to healing and to prevent an oxidative stress. So the mitochondria is major in prevention because it is a major it's contributes to the issues with cognition and Alzheimer's. And it also is majorly, in other words, mitochondria is found most in the blood-rich tissues of the heart and the brain. And this is where you're going to have the most impact with improving mitochondrial health, but also in our muscles as well. So you see, prevention is key, and functional medicine is right in there at really optimizing the body. And really, when it comes to prevention, functional medicine testing and a functional medicine practitioner and a functional medicine practice like over here at South Florida Integrative Health Center is going to be the way to really ideally practice prevention, because we understand the biochemistry and the underlying causes of aging. So it's not just getting a number of what my biological age is. It's how are you aging well? Well, how are you going forward with aging well? And this is what we can help you with here in functional medicine. And if you have any questions, please reach out to our clinic, South Florida Integrative Health Center, located in Miami and Miami Beach. We're here to help people. You can call and make an appointment. And if you have any questions, leave your comments below. You can reach us at www.sfihc.com is right there, and give us a call, direct message. Everyone have a healthy, happy day.